my name's Meredith Allen. I'm a student physical therapist assistant at Jeff State, and today I want to talk to you guys about the phases of cardiac rehabilitation for PTA 251. So, what is cardiac rehabilitation? This is a rehab program that is monitored and supervised by medical professionals, including physical therapists, for people that have had a heart condition or are currently dealing with a heart condition. These conditions can include angina, heart failure, peripheral artery disease, coronary artery disease, a heart attack, or surgeries such as coronary artery bypass graft, stenting, a valve replacement or repair, a pacemaker implantation, or a heart transplant. So some CDC statistics about cardiac rehabilitation include every year approximately 1 million people survive a heart attack in the United States, and these people could benefit from a cardiac rehab program. The study showed in 2001 that only a third of the people that could benefit from this actually took advantage of being in a cardiac rehab program. It also said that some statistics were that people 70 years and older are less likely to join the program, and that a physician referral is the most powerful predictor in whether or not a patient will be in a cardiac rehab program. So phase 1 is the acute inpatient phase, and this phase begins while you're in the hospital during your stay, while either after you've had a heart attack, after you've had heart surgery, whatever the case may be. So the goals of phase 1 for physical therapy are checking mobility and heart health. They are determining the appropriate assistive device as needed and helping with discharge planning, figuring out where the patient will need to go next after the hospital stay, and reminding patients of sternal precautions such as not pushing, pulling, lifting a lot of weight, coughing with a pillow, things like that. So this is a little sheet here that they may get with their sternal precautions. We need to remind them of that. We need to help choose an assistive device like one I have here. So this could be, this is a standard walker, and depending on the patient, it could be the right thing they use. More times than not, they may need a rolling walker and EVA walker in this phase as well. So some PT considerations involving phase 1, these patients could have orthostatic hypotension, so it's important to monitor their vital signs at all times. That's why I have this here, making sure you are always checking their blood pressure, checking all their vitals, heart rate, to make sure, because these are heart patients, so it's important that we know what their vitals are at all times, beginning of the treatment, middle of the treatment, end of the treatment. Because these patients are heart patients, the Borg RPE scale tends to be the best way to check exertion for these patients, letting them tell you how they feel symptomatically. Phase 2 is the subacute phase. It really just deals with patient education, and sometimes it gets lumped in with phase 1. So depending on where you get your information from, there could be 3 or 4 phases, of cardiac rehab. So today I'm going to tell you about all 4, but just know that phase 1 and phase 2 sometimes get lumped together. So this phase usually lasts from weeks 3 to 6 in an outpatient facility after the patient has left the hospital. And the goals for this and for PT include safely increasing the workload that the patient can handle, figuring out where their beginning line is, their baseline, and how we need to progress from there. And really more so about patient education on exertion and how they can check and monitor their own vital signs and symptoms. So it's really all about education and progressing them to be able to tolerate more exercise and figure out where to go from here. So phase 3 is your intensive outpatient. This phase usually includes about 36 outpatient visits, give or take, and it's slowly increasing the patient's level of exercise tolerance to help them become more quote-unquote heart healthy. So the goals for physical therapy in this is where the PT is going to evaluate their strength, their range of motion, their vital signs, scar mobility if necessary, and then the patient's going to get a program with a warm-up, and then usually some kind of walk on a treadmill. Usually walking is a good starting baseline for these patients. They may get some lightweight resistance, so depending on their strength, they could start some lightweight weight training. They could do some lightweight TheraBand, something like this, depending on what they are in need of. And then they'll learn about having a cool down and learn how to progressively increase this workload as they can tolerate. And then they'll also be educated on nutrition, diet, and stress management. So some pictures from phase 3, some lightweight resistance, treadmill, that's kind of what these patients kind of start, and then it progressively gets more intense as they go through these 36 visits. And then phase 4 is your maintenance phase. It's not always covered by insurance because it could be considered from the time that they are discharged from outpatient till the time that they pass away. So the goals of this are just to do regular checkups with your doctor, making sure that you're monitoring your own vitals, monitoring how your heart is, increasing your workload. Can be checking in with your physical therapist, considering rehab and anybody in the rehab program that you've been with, to how you can progress this. So a lot of times people will check in with their PT to see, hey, this is what I've been doing, what should I do from here, and help you make the right decisions on your exercise progression. They'll continue with their better diet, managing their stress. That is what the goal of phase 4 is just really that maintenance phase. Once you've had this issue in the past, getting better, staying stronger, staying healthier. So some pictures from phase 4, kind of walking in the neighborhood, things that they can do on their own outside of physical therapy and outside of the facility, eating better, doing the right things for their heart. So in summary, there are 4 phases of cardiac rehab. Depending on where you look, there could be considered 3 because phase 1 and phase 2 sometimes get lumped in together. But physical therapy is an important part of every phase, whether it's patient education, fitting them for the right assistive device, increasing their exercise workload, whatever the case may be, and whatever the patient's situation, physical therapy is an important part of cardiac rehab. And these patients need us, and they need us to be the best that we can be for them to keep them heart healthy so that what they've dealt with in the past doesn't continue in the future. And then here are my references where I learned about some things for cardiac rehab. And I just want to say thank you for listening. I hope I've taught you something. Thanks.